episode 13 of Drug Talk. As usual, I'm your host, Garrett Campbell, and today we're going to be talking about a medication known as Sumatriptan, which has a brand name of Imitrex. Now, Sumatriptan is a medication used for migraine headaches. It's not a medication used to prevent migraines. It's one that you would take when you actually feel a migraine coming on. That can be with or without an aura prior to the migraine. Now, they're available as an oral tablet. One version of the tablet can be swallowed whole, where another one, which is the DF, is actually a disintegrating film which will be placed under your tongue and then it would dissolve. Also, this medication is available as a subcutaneous injection, which is an injection that goes just under your skin. As well, you can use it as an intranasal spray. Now, the tablets are available as a 25, a 50, and a 100 milligram tablet. The injection is a 6 milligram injection, and the nasal spray comes in a 5 milligram and a 20 milligram. Some contraindications or reasons you cannot use this medication are as follows. If you have history, symptoms, or signs of ischemic cardiac, cerebrovascular, or peripheral vascular syndromes, this medication should be avoided. Valvular heart disease, as well as cardiac arrhythmias, especially tachycardia, which refers to a rapid heart rate, fit into this category as well. Because Imitrex or Sumatriptan can increase blood pressure, if somebody has severe unstable hypertension or high blood pressure, then they shouldn't use this medication. Sumatriptan should also be avoided in individuals who have taken a monoamine oxidase inhibitor. This is a medication we'll discuss in future episodes within the last 2 weeks. Sumatriptan also shouldn't be used within 24 hours of using an ergot-containing medication or ergot-containing drug, such as Migranal. Also, they should be avoided in patients who have severe hepatic impairment, that is, liver impairment. So, as I mentioned at the start of the video, Sumatriptan or Imitrex should only be used when someone has a clear diagnosis of migraines. If someone was going to use this medication, there are some precautions they should know before administering it. Although the drug monograph states that only about 2% of people actually experience drowsiness with this medication, it's still important that when you use your first dose, not to drive a motor vehicle or do anything that requires concentration that could result in a dangerous accident happening if you were to become drowsy. Another precaution would be the possibility of overuse medication headaches. Some clinicians think that around 10 to 18 doses per month is okay, but you should always try to decrease the frequency of use as much as possible. Only use it when you actually know that you feel a migraine coming on. If you use it too often, you can experience migraine overuse headaches. Occasionally, if someone has predictive risk factors for coronary artery disease, sometimes their physicians will have them take their first dose in their office. For intermittent long-term users who have now acquired characteristics of coronary artery disease, they should receive periodic cardiovascular evaluations during the course of their treatment. If symptoms consistent with angina or chest pain emerge, occasionally a physician will have a patient get an ECG or echocardiogram done. Now, in terms of using the medication, as I mentioned, it's available as a tablet, a spray, as well as an injection. We'll start by discussing the tablet. Now, the usual dose is 50 milligrams or 100 milligrams, taken orally. The maximum dose is 200 milligrams in a 24-hour period. After taking a dose, the dose can be repeated in 2 hours. It's common in practice that a pharmacist will instruct a patient that if they have some benefit but not complete resolution of their migraine, to take that second dose after the 2 hour period. However, if an individual had no benefit, there may not be much of a point to taking that second dose, and oftentimes we'll just advise patients not to bother. The nasal spray follows the same guidelines as the tablet. That is, use a dose. If you don't have complete resolution, you can repeat that dose in 2 hours. The maximum daily dose for the spray is 40 milligrams in a 24-hour period. It changes a little bit with the subcutaneous injection. That is, you can repeat the dose for this administration method after 1 hour. The maximum dose for this administration form is 12 milligrams per 24 hours. Some individuals find benefit using an NSAID, such as ibuprofen, when they use their medication to try to treat their migraine. This is something that you should talk about with your physician or your pharmacist with first, though, before you go ahead and purchase this medication. Now, with regard to side effects, they actually differ based on which dosage form you use. Today, I'm just going to discuss some side effects that seem to happen with the oral form. With the oral form, the frequency of side effects changes depending on your dose. That is, these side effects are dose dependent. I'm going to list the side effects and the percentages for the 100 milligram dose. That is the max strength of the tablet. Around 5% of individuals experience neck, jaw, and throat sensations, such as pain, pressure, heaviness, tightness, or difficulty breathing. Dizziness happens in about 6% of individuals, and headache comes in at 3%. The headache would present differently, probably more mild than the migraine you're using the medication to treat. 2% of people experience dizziness, nausea comes in at 11%, and vomiting at 4%. About 2% of people experience some discomfort or abdominal pain. And lastly, about 2.3% of individuals can experience some throat or tonsil symptoms. That's all I have to say about Sumatriptan or Imitrex. Not much to say about this medication. As always, this channel is to be used for information purposes only and not to make any personal healthcare decisions. Always consult your personal healthcare provider before you make any decisions about your medication.